Hello, everyone. My name is Desiree Cochran Norfolk. I am a Master Addiction Counselor certified through the Georgia Addiction Counselors Association. I also hold a CAC2 with them as well, and I also am a certified anger management specialist and training for domestic violence as well. I also have training in prevention specialists. So, today we are going to be talking about what is drug addiction counseling. So, in this unit, we're going to spend a little time to understand counseling in general, and then we're going to spend some time to discuss the basic principles and the key concepts of drug addiction counseling. Drug treatment counseling is the main focus of this particular workshop. I hope that by the end of this unit, you're going to be able to provide the definition of counseling, understand the context of counseling, understand the existing myths about drug use and drug users, state the differences between counseling and health education, and lastly, to identify attributes that make an ideal counselor. So, first of all, we need to know the context for counseling. So, who are the kinds of people who come for counseling? These might be people who are depressed or abused, maybe had a problematic childhood, those seeking guidance or answers. Maybe they're having problems with recovery issues, or they realize they have a drug and alcohol problem. Um, just people that are dual diagnosed, they just have problems and they need help. The next question is, what are the kinds of things that individuals return from drug rehab centers uh, feeling? Well, they're dealing with new people, places, and things, a new identity. They're trying to avoid relapse. They're probably scared and hopeful. It's a new situation. Um, but the community has this attitude of the moral model. We used to be under the moral model where uh, drug and alcohol addiction was a moral problem. You were just a bad person. And if you could change your ways, you could change your drinking. But now we've moved to the medical model. And the medical model says that there's something going on inside of us. There's chemical changes, pathway changes in the brain, so on and so forth. So it's making it a little bit more difficult for us to actually make that decision to quit. So now we're under the medical model where addiction is a disease, not a moral problem. But a lot of the community still operates under that moral model. And so they look at people who have an addiction with pity, maybe fear, take them somewhere else type of attitude. They see them as evil or bad or a junkie, or maybe they can't change. Um, they label them. Maybe they're going to steal from me. That's typical ideal of a addict and the attitudes that people have in the community towards them. So when a person comes to seek counseling, they may have some concerns of their own that they need to address, and they may be scared to reveal secrets. They may be scared that they might be seen as sick or labeled. They might have issues concerning their privacy or confidentiality. What are your qualifications as a counselor? What's the quality of service? What's the accessibility of that service? And then they're going to expect you to help them. They want advice. They want their problem to just go away. They want to fix themselves. And so they're coming to us for their treatment. So think about this question for a moment. Can you tell me why drug users come to seek counseling? I want you to put that in the chat, the discussion board that's in this lesson. Why do drug users come to seek counseling? You know, they my supervisor used to say there is no volunteer for drug and alcohol treatment. And what he meant by that was nobody just comes to the realization that, oh, I have a problem and I need to get treatment. There's usually some sort of outside force that triggers that realization. So maybe they're forced by their parents or the community or law enforcement agencies. They may come for methadone treatment, not for counseling, but the counseling was a part of the treatment, so they joined up. And they know that the counselors can help. They come to please someone, like a spouse or a partner or a family member. Or maybe they just want to quit or reduce their drug use. So let's spend some time on answering this question in the discussion as well. Why do you think drug users don't seek counseling? So I've asked this question before, and some of the answers that people threw out to me were many of them think or believe that only they know their problem and no one else can really help them. They deny that they have a drug problem. They're too proud to talk about their personal issues or their faults or their weaknesses. Maybe they're afraid of a breach of confidentiality. Somebody might find out. They've failed many times before and they don't want to try again. Maybe they've had a bad experience with a previous counselor who dictated terms or orders for them. Um, Maybe counselors have not used drugs, so drug users think they won't understand. In their daily lives, drug users experience discrimination, stigmatization, and rejection, and they're often viewed as criminals or outcasts and a target for that community's anger and fear. One thing that I want to bring up, when a client has said to me before, you haven't ever used drugs, so you wouldn't understand. And I took this from my supervisor. He trained me on this one. Um, he said, well, I used to work with sex offenders. So, how many people do I need to rape in order to successfully treat a sex offender? And so, the point there is I'm a trained counselor. I'm here to help you work on your issues. I don't need to have experienced your issues to help you work through them. You're the expert in your issues. My role here is just a little bit of guidance in helping you work through that. I'm not here to tell you what to do. As a counselor, it's important for you to understand a drug user's worry. They may worry about further discrimination, their future, others talking about their drug use, a lack of treatment access. They might be afraid counseling won't work or lack of treatment for maybe HIV or some other bloodborne illness. So when clients come to you for counseling, you have that opportunity to help them understand how counseling can help relieve a lot of these worries that they have. You're going to learn many techniques and skills throughout this training to assist your clients to alleviate those worries. Although in recent years there is an increasing number of community education programs to raise awareness and understanding about drug use, drug users, and community health, there remains many myths about drug users. So let's think for a moment about some of the myths that we have heard or we've heard other people talk about just in general. What are some of the myths about drug use and drug users? Just take a few moments to jot down a couple of these on your own. Um, some of the ones I normally hear are people who use drugs are always morally weak, addicts are beyond help, they can't change, all drug users are drug addicts, all drug users are criminals. These are just some of the commonly held myths, but I want you to kind of take a few minutes to think about which ones you have heard. Have you heard these? Have you heard other ones? And why do you think I'm asking you to discuss the myths that you've heard? If you can think of any more, please put them in the discussion box in this lesson. So, which of these do you think are myths and which do you think are true? The ones that I have on the screen. Well, some of them can be true and some of them can be false, but for the most part, they're all they're all myths. Not all drug users are criminals. However, they can be criminals. Drug users often resort to crime to pay for their drugs. Some drug users are criminals before they start using drugs. Many people in the community feel that drug addiction is a moral weakness, and they don't understand that it's a chronic relapsing disorder that involves changes in the brain and the body and the spirit of the drug user. They don't understand that these changes make it difficult for some individuals to avoid using drugs. So, what is counseling? Counseling is the purposeful act of providing professional guidance. It utilizes various psychological methods and techniques to guide the client in a constructive direction. There are some key words that I want to discuss in more detail with you. One is the word intervention. Counseling is an intervention. When you provide guidance or assist a client in making a decision, you intervene in order to help that person to achieve a desired outcome. I would also like to discuss the phrase confidentiality, explore their problems. Although individuals may come to talk to a counselor about their problems, they often want to be sure that that visit and the information is kept confidential. Remember, counseling deals with sensitive issues, and breaking that confidentiality could cause serious problems. And the last part of the definition I want to discuss is the word capacity, where it says enhance their capacity to solve their own problems. So, in order to be effective, counseling must be client centered, based on their individual needs. The goals and the objectives of counseling should be negotiated between the client and the counselor. Ultimately, clients should feel empowered to solve those problems on their own. The counselor assists the client to understand what options are available to them and to help them make informed decisions on how best to proceed. Counseling is catered to the specific needs and the issues and circumstances of each individual client. It's an interactive, collaborative, and respectful process that helps clients develop autonomy and responsibility for themselves. Counseling should also be focused with specific goals obtained by asking questions, eliciting information, reviewing options, and developing action plans. It takes into account an individual's social and cultural context and readiness to change. Counseling can be provided to individuals, groups, and families. Counseling is most effective when it's voluntary. It's not possible to direct individuals to change their behavior. The use of motivational interviewing, which I cover in a different course, provides a mechanism for encouraging change. Conversations are a mechanism for an exchange of information, but they are not purposeful in changing behavior. Counseling provides more than just a conversation in that it provides direction and guidance for behavior change. Collaboration in effective counseling is essential. It's going to be important to remain open minded and flexible in your approach. And if you appear to be too intrusive into the client's thoughts and behaviors, they might react by refusing to cooperate with you. Just remember that counseling is an interactive process through which both counselor and the client are cooperating on achieving an agreed upon short term goal or maybe multiple goals. You're going to place your faith in each other rather than in a higher being. One thing I do want to address though, I said that it's most effective when it's voluntary, but it doesn't necessarily mean that it's not effective if it's involuntary. Just the fact that the client is there and getting the information from you, learning some tools and techniques, um, the research has shown that it can be just as effective um, for those who are coming involuntarily. So let's talk about the difference between a health educator and a counselor. Let's talk about your understanding of the differences between counseling and health education. So, counseling is confidential, whereas health education usually isn't. Counseling is usually one on one or in a small group. Typically, health education is done in small or large groups of people. You're typically not going to have that one on one experience in a health education. And then counseling is going to evoke strong emotions in both the client and the counselor. But health education is going to be emotionally neutral. And then in counseling, the counselor is going to listen attentively and reflect. The goal of counseling, they should be talking way more than you as the counselor. But in health education, the educator is going to talk more. They're there to give information. And lastly, in counseling, it's focused and specific and goal oriented. But in health education, it's just going to be very generalized. It's not going to be very specific or goal oriented for the individual. Feel free to discuss any more differences between counseling and health education in the chat box in this lesson. A person can be both a counselor and a health educator, but the most important thing is that the person knows which job they are doing. Former health educator counselors may often confuse those two roles. Just remember to set some ground rules for your client before you start the session. It's important to say that you can provide both education and counseling during a counseling session. So let's think about an example of the difference between counseling and health education. In conducting a session on safe sexual practices, health education would entail describing the correct use of a condom, while counseling might entail discussing a client's concern about why his penis may not stay hard while using a condom. So, in counseling, the information used is going to change attitudes and motivate behavior change. It's going to be issue oriented and based on the needs of the clients. But in health education, the information used is to increase the knowledge and to educate them. It's going to be very content oriented and based on public health needs. So, given the principles of counseling, what qualities do you think make an effective or an ideal counselor? Put those in the chat box. What qualities make an effective or an ideal counselor? Some of the people in when I've asked this question previously, they said creative and imaginative, practical, they're going to show respect for the client, they're going to be action oriented. It doesn't impose the counselor doesn't impose their own views or concerns. A good counselor is going to be this creative and imaginative, and they can help their clients identify the linkages between their thoughts and their feelings and their behaviors. And many clients are going to appreciate counselors who can help them organize and articulate their thoughts around these specific goals that they'd like to achieve. And a good counselor is going to be flexible and give that practical guidance on ways that clients can achieve those goals. We want this mutually respectful relationship that's going to lead to shared communication and agreement on how best to proceed. It's critical not to impose your views or concerns on your client, but rather just to understand their views and their concerns. So, these are the things that you need to avoid when providing drug counseling. We need to avoid moralizing. Remember, the goal of your work is to help clients solve their problems. We're never going to moralize their experience. We need to avoid ordering. You're their counselor, not their supervisor or their employer. You're not their parent. You have no right to tell your clients what to do. We need to avoid threatening. Try to avoid attitudes or language that makes your client feel like they're being threatened. You should provide a supportive environment for your clients to share their problems. We need to make sure we're not arguing Clients may not heed your advice and may use words that hurt you. Stay calm and help them understand that they have the right to make their own decisions and that you're going to respect those decisions. We need to avoid disagreeing with them. Your task is not to determine what's right or wrong. This is going to lead to disagreement between you and your client, which ultimately is going to stall that counseling process. We need to avoid over interpreting. So, a counselor's job is to understand his or her clients and to link their thoughts and goals with a coherent plan. Counselors must avoid over interpreting what the clients are telling them. Over interpreting is going to lead to misunderstandings of or inappropriate focus on some of the factors that are critical in influencing behavior change. We need to avoid sympathizing. I discuss empathy and sympathy later, but a professional counselor really should not become emotionally involved during the counseling session. And then lastly, we need to avoid judging. Counseling assists clients to identify what puts them at risk. Judging your client is going to lead to mistrust and denial of problems. You should listen without judging or criticizing or blaming and try to gain a better understanding of your client from his or her point of view. So, in this session, we talked about how counseling helps individuals to take charge of their lives by helping them to develop the ability to make wise and realistic decisions, altering their behavior to produce desirable consequences, and providing them some useful information for informed decision making. Counseling can be for individuals, couples, or families. It should be provided by counselors who are creative and imaginative, use a practical approach, are able to show respect for their clients, they're action oriented, and they don't impose their own views or concerns. And just lastly, counseling is different from health education. Just want to thank you for participating in our introduction to general counseling. This is the first lesson in the What is Drug Addiction Counseling training. Any questions or answers to the questions that I've asked in this training can go in the discussion box inside of this particular lesson. I will be available to answer those questions that pertain to this unit. If you have any questions about the material that's covered in a later unit, please address those questions in that particular lesson. Once you have completed all of the units in this training, you'll have to complete each one of those. And then at the very end, the last lesson is labeled completion. You'll take a quiz and the course survey. And upon successful completion of the quiz, you will be emailed a certificate of completion for this course. This course is worth 6 credit hours, approved by the Georgia Addiction Counselors Association. This first lesson was Introduction to General Counseling, which will be followed by the basic concepts and then the key principles in drug addiction counseling. And then we'll follow that up with counseling skills, counseling techniques, and then lastly, the last lesson is counseling procedures. If you have any other questions or concerns, please feel free to reach out to me at my email, desiree.cochran@gmail.com.